Why do most therapists for speech delay not meet expectations of parents?
Yeah, the question is, the reason is very simple. How can you teach a child to speak who can't sit even for a minute? How can you teach a child to use toilet? Here I'm talking about toilet training, who can't even settle for 3 to 5 minutes. So what you're trying to take him to run is none of his business. It's not the first thing he needs at the moment. Some of the children are struggling with a lot of pain, having a constant overstimulated nervous system, stress levels are high, and they're always hyper. So it's even very difficult for a speech therapist to do anything, because the reason why sometimes you find it takes years, it's not because it couldn't be done in a few months, it's because you are missing the first step. And here the first step you should start. Use Kunga therapy. Why is Kunga therapy the best step to start before? You do it like 3 months, then you engage speech therapy and occupational therapy. The reason is because Kunga therapy is going to help with body and brain connection. It is going to help with enough blood supply to the brain. It is going to help with enough dopamine release. And that one is going to calm the nervous system. So when in 2-3 months after doing Kunga therapy, your child can now sit for 5, 10 minutes, 15 minutes, 30 minutes, 1 hour, all the pains he had in his system are no longer there, then it is going to be easier for a speech therapist to teach him the skill of speaking. It is going to be easier for an occupational therapy to teach him how to use a toilet. So the reason why many therapies are failing, it's because you are teaching a child how to speak who can't sit even for 5 minutes. You are teaching a child to use toilet who can't sit even for 10 minutes. It's very difficult.